guys, this is Dr. Vince from FTR in Joliet. Today I'm going to piggyback off of the previous videos that I've done, and we're going to continue to talk about the hip and hip abductors, or the outside muscles of the hip around the butt region, and how to get them stronger. One of my favorite exercises that I'd like to do with my patients, if they're able to do it, is it's called a hip circle walk. And if you Google Mark Bell, obviously I got to give this guy some credit. He created what's called the hip circle. It's not this band, but it's a very strong band, typically used for athletes. And so my patients may not be strong enough to use that band, so I'll throw one of these lighter TheraBands around their hips or around their knees and just have them take their feet out to wider than shoulder width. And then from here, walk slightly forward and backwards, trying to keep themselves from squirming like so every step that they take. Okay, trying to maintain a rigid posture, forward and backwards. Okay. This places that muscle in the close to end range position for that muscle, which is going to make the exercise a little bit harder to maintain that contraction. Another exercise that it's common to see is this sideways stepping, okay, this lateral step side to side. Okay, this also works the muscle, but it works the muscle through the range of motion. So that's another option that you'll see. The final option that you'll typically see is something called the monster walk. Okay, and I always joke with my patients, if you put your arms forward and you start making grunting noises, it almost looks like Frankenstein. And so this is what you typically see. It's almost like a half moon that happens from your foot inward to outward, walking forward and walking backwards. Okay. Ideally, these exercises should be felt in the hip butt region. Okay. When you kick your feet out, try your best not to turn your feet out. Keep your feet fairly forward. Okay, 10 to 15 degrees with an out flare. That's normal. But when you start getting into this position here, you change the way that the muscles are aligned, and so you change the muscles that actually work during this exercise slightly. And so again, typically this muscle here, we tend to see it weaker in adolescent females. When these muscles are weak, they've been implicated in low back pain, knee pain, patellofemoral pain syndrome, IT band syndrome, and impaired balance. So if you have an issue here, hey, you can always come see me, but definitely watch the videos. If you feel up to it, give the exercises a try. I would prefer you did it under the observation of a physical therapist. If you have any questions, leave some comments below. Thanks. Have a good day.